Hello. This video will outline how to address an annual wellness visit and the correct elements that need to be included to close gaps in care. My name is Pamela Muse, Operation Systems Analyst with Holston Medical Group. Let's first look at the schedule. The patient has 2 appointments on this schedule, distinctly different appointments. You need to be extra careful on which appointment that you select to open this note. So we have the annual wellness visit highlighted, and I'm going to go right up to the toolbar and just go ahead and open the note. The correct note type will be Medicare Wellness with PAF, and click OK. Now, in an annual wellness visit note, we will still complete the customary workflow as in a regular visit. We will still reconcile allergies, medications, and problems, as well as documenting correct social histories. So let's just do that really quick. I'll go ahead. So I will ask the patient about his surgical history, family history, reconcile as I go, social history, does not use illicit drugs, former smoker. Very, very nice. So anytime you see denies smoking, denies alcohol, that's an invalid status. We need to correct that. You can right click on that incorrect entry, suppress that, and then enter the correct status. Allergies, we will go ahead and go over allergies with the patient and reconcile that as well. And okay. The Medicare Assessment form is populated within the body of the note. We will go over these questions with the patient. I will check this box. That's important because I did go over all of those areas with the patient. So when we get to the questions for the Medicare Assessment form, if the patient has had a colonoscopy, we need to make sure that that documentation is available in the chart. If it is not available, we need to obtain that information and scan it into the chart. So let's just say that he did have his colonoscopy, and I'm going to enter the provider. And in the chart viewer tab, I can quickly go and search gastro, and had that date been the correct date, within the year, I can certainly see. I can even pull this over and go back to my chart viewer, highlight the note, stay in my note, and do a cross-reference using that chart viewer function, which makes it really nice. You can see the whole note and exactly what was done during that visit, that gastro visit, and so on. Oh, I'm sorry, I put the wrong information in there. So I can see that August the 6th of 2019 was the last colon this patient has had. So I do not see any eye ophthalmic reports, and I'll put no. And the patient says that he does not want to do this. And we will need to defer that in just a little bit. I'll show you how to do that. We will not answer that. And these social determinant questions, we will go ahead and go over that with the patient as well. And he says no to all of those. So we will address the fall risk screening. Have you had an injury as a result of any fall in the last year? The patient says no. Have you had two or more falls in the past year? The patient says no. Whatever the patient says, you can check whichever box. If you click yes, by clicking yes and you see the dollar sign, that will automatically drop a charge for that. Fall prevention education material provided during the visit. Yes, we're going to do that. The patient does not have a diagnosis of depression, but it's been a year since we have asked these questions, so we do at the very least need to ask the PHQ-2. Yes or no. If the patient says no, we can stop there. If the patient says yes, we will need to complete the PHQ-9. And those are located right here in this little radio button. Then you can complete those. Depending on the answer, that will drop a charge as well, the appropriate charge. The immunizations, the patient does not want the shingles vaccine. Say no, he does not want that. He declines that, and we are going to defer the eye exam and the shingles vaccine. Be sure to address these items here, the diabetic, COPD, and CHF radio buttons. If the patient is a diabetic, we need to go ahead and answer these questions. Find out what the last A1C is and check whether it was less than 9 or greater than 9. And then the most recent microalbumin. You can enter that information in here. Same way with COPD. We need to look for the spirometry tests, find out if the patient has had that. We can always go to results and find out that information. Navigate through the chart to find this information. What is very helpful is if you try to get some of this done the night before, look at your schedule the evening before, and kind of run defense and see what some of those answers would be for some of these questions. Ask the patient if they have seen any specialist, if they do have a specialist. Cardiology. Patient says yes, he sees Dr. Williams. Okay. Pain scale. I always ask this. Are you in any pain today from 1 to 10? Patient says just 1, but that's always. If the patient's blood pressure is greater than 140 over 90, either of these numbers, you must recheck that blood pressure. So let's look at the vital signs here. So it was 145 over 80. So I'm going to recheck that blood pressure and document as such. We'll just continue on downward. Patient is not registered for the portal and they're not interested. And down here is some verbiage that we need to pay attention to, and I had already mentioned this before about the smoking status. Need to make sure that is correct and entered in correctly. I'm going to commit, save and continue. And now I need to defer the shingles vaccine. So I'll go to the beaker and go to immunizations. And I'll select that. I am careful to not check the button at the top that says record without ordering or the record administration. It's not in your view due to the sizing of this screen, but at the top we are in the order entry, and that's where we shall stay. I'm going to click on the status. It's temporarily deferred, and we are going to defer that for 99 years. And the patient refuses. I will now get a message about the consent dialogue, and we will grant that always. Patient will decline that. He is declining that. And I'll change it to my provider. And the reason for I will uncheck the social history of widowed. Mercy. And just show the active problems. I'm going to add a new problem, and I'm going to put need for shingles vaccine. Forgive me, I chose the wrong one. I'm going to just click on the words, but be sure to uncheck that box because I'm not going to assess that in any way. Click OK. I'm very careful to not click, I'll say it one more time, I'm very careful to not click record without ordering or the record admin tab at the top. I'm going to save and return, and I need to go to procedures, and I'm going to type in I. I'm going to choose ABN not obtained because we are not going to order this, and click OK. Now I will navigate to my orders. By the way, if you do not have your tabs on this left hand side of this box, you can click on the tile, and that will sort your tabs up along the top. It just makes it easier to see. I'm going to right click and edit, and up in the status section of this order I'm going to choose temporarily defer, and then click details, and I'm going to, again, just like with the immunization, 99 years, patient refuses, OK. And I'm going to save and close ACI, which stands for Add Clinical Item, by the way. I will commit, save and continue. Now I'm just going to make sure that I've got everything done. I always double check my work. Since I retook the patient's blood pressure, I'm going to enter in the new blood pressure prove that I actually did take it. Click OK. Back to note. And now I will save and close my note so the provider can do his or her section. Just remember, if the patient has a diagnosis of depression, you must complete the PHQ-9. You also must have documentation for mammogram, colonoscopy, or eye exam in the chart. If not, you can obtain that either from calling the clinic the patient went to and then get a copy of that, have them fax it to you and scan it into the chart, and make sure you defer all procedures and vaccines such as your flu, your Prevnar, eye exams, especially colonoscopies. You will go to that procedures tab and you will temporarily defer those items for 99 years, just as you do with the immunizations. If you have any questions regarding how to complete an annual wellness visit, don't hesitate to reach out to the Operations Systems Analyst team. You can always call the help desk 1504 and they will contact us. Thank you for watching this video and stay tuned for more.